And thank you so much to WADADIA for making this happen. We are here at WADADIA Hospital in Malindi. We've been here for the whole week, for the last 7 days actually, helping these women who have had a myriad of maternal health conditions. And my name is Anthony Wanjala, an obstetrician gynecologist and also fistula surgeon, specializing in pelvic reconstruction. I've been a medical doctor from the year 2009 and specifically in the reproductive health field from the year 2015. And over the years, it's been my joy actually to help the many women who have been had many challenges, largely birth-related trauma, birth-related injuries, both short-term and long-term complications. Yes, and usually when you help these women, you will see the joy, the happiness it brings them. Many of them have had many social challenges, inability to, socialize with their peers at home, in the community, in their social groups. And so anytime we help them and we're able to bring a joy to them, you'll see the joy on their faces. It also makes us happy knowing that we've been able to just restore their dignity. Yeah, so over the years, the experience I've gathered in my medical practice in the reproductive age, rather in the reproductive field, I have learned a lot from those who have gone before me, who have gladly and willingly shared their knowledge and experiences. And so it's just a duty and responsibility that all that have gathered should be able to share it out with others, make them better. And this cuts across to all the clinical personnel, the doctors, the clinical officers, the nursing team, and any others that will be interested in learning. It just makes sense that all that I've gathered and accumulated over time, I should be able to share it with them so that they also become better. I become better by sharing it out and them being better. I don't lose anything. I actually become better. But more specifically, here at WADADIA Hospital, we are doing everything that we can to be able to set up systems by empowering the personnel, by empowering the medical team, empowering even the non-medical team. And so part of the training was just to help them be better doctors, be better nurses. And so eventually when you set up these systems, it will not be dependent on me, Wanjala, or somebody else being there all the time. If you set up good systems, make them better clinicians, make them better nurses, the system will just run on autopilot. The work we do is not easy. It's actually tough. It's difficult. A third eye looking at what we do, see us doing it with a lot of ease, and they will tend to think it's easy. But the work we do is hard. It's not easy. We operate on long hours. We operate late into the night. And the problem, these challenges that women go through are so many. So at any point in time, we have so many women. It's unfortunate that even now we've not been able to operate on all women that we intended to, just because of the time frame. We only had this 1 week, so we're having to reschedule other women to come another time when we are able. So one of the most challenging parts is just that some women have complications that they've had them for a very long time. Women have had fistula for over 10 years, over 20 years. Some of them have had fistula that have been repaired for several times, 4 times, 5 times, and yet they keep leaking urine. So when they come to us, we still need to do something about it. And so, so that becomes a big challenge. Some of these women, we are treating them, yes, and we're able to even heal them in terms of, curing the fistula and making them achieve continence. But fistula is not just a physical disease. It's also a mental, social, psychosocial disease. You know, some of them are separated from their partners. Some of them are divorced from their partners. Some of them have been rejected by the communities they come from, and so it behooves us as the people are handling them to find ways of not just treating the fistula, but reintegrating them back into the community. And so we get lost sometimes because we may not have all the resources to empower these women, maybe offer them some sort of short training, be it something like tailoring, something like computer, so that when they go back to the community, they have some economic activity that will give them some bread on the table and make them live a relatively comfortable life. And so that becomes a challenge for us when we're able to heal the fistula, but we're not able to fully reintegrate them just because of limited resources. I mentioned earlier, our work is hard, it's difficult, it's tough, but it's very rewarding at the same time. So we will do it and we'll keep doing it. Or rather, I will do it and I'll keep doing. Despite the difficulties, I'll keep doing it because at the end of the day, it's very rewarding. When a woman who came to you, leaking urine or leaking stool, and they are destitute, they're very depressed, socially isolated, very low self-esteem, after you do what you do and you see the smile on their face, they just glow, and you see sometimes tears because they want to thank you for what you've done,